Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. Join us as we talk with national experts and advocates about strategies you can use in the pursuit of quality long-term care. During this time of year, nursing homes can expect to see an increase in people visiting their loved ones. This increase puts everyone at a higher risk of catching a cold or respiratory illness. Join us for a conversation as we dive into the latest CDC guidance on respiratory illnesses, including COVID-19. We are joined by Dr. Erika Wallender from the CDC and Lori Walsh, Consumer Voice Policy and Program Specialist, to discuss practical steps in reducing infection risks and best practices for staying safe during this upcoming respiratory season. We also remind residents and their families of their rights and protections while navigating life in a nursing home.
Over the past several years, it feels like everyone has had a crash course in terms of learning about viruses, infection prevention, and how to protect themselves and others from getting sick. But as we transition out of the pandemic as a country, we've seen a lot of changes, and our world looks entirely different today in 2024 than it did a few years ago in the middle of the pandemic. When we think about people living in long-term care, I think most of us realize we're thinking about an incredibly vulnerable population. And so here in this 2024 world, as we enter respiratory season, I think our fourth respiratory season since COVID started, we wanted to check in with the CDC and talk about the status of vaccines, regulations and guidance, and just really where we are now and what things might look like moving forward. We know for any long-term care consumers or family members listening, you might have a lot of questions about what should be happening, what might be happening in terms of some of these issues. And so, Erica, we're so glad you were able to join us today for this conversation. Thank you so much for being here.
Oh, thanks for having me. It's a real pleasure.
Yeah. So I wanted to start with vaccines. As we move into cold and flu season, what recommendations are there in terms of vaccinations for COVID, the flu, RSV, pneumonia, all of these sort of viruses and conditions in nursing homes?
Yeah, that is a great place to start. And really that's for CDC one of our biggest priorities for this respiratory season.
Yeah.
Every year in the fall and winter, it's a time when there's a lot of colds and flus going around. And luckily for our, the three viruses and one bacteria that cause the most severe respiratory illness for our older adults and our nursing home residents, we have vaccines for. And what's so exciting about
Right.
the vaccines is that they reduce that risk of getting in the hospital, getting the bad pneumonia where you need oxygen, getting that severe disease. And so we have vaccines for a new vaccine, updated vaccines for COVID-19, the flu, influenza, respiratory syncytial virus, which is RSV,
I'm so
and
glad you
then
said that because I didn't know what it stood for all this time. I just call it
I know,
RSV,
even I
but
have to remember. It's a catchier on RSV, but yeah, it's a virus that causes a lot of infections in babies, but also
Mhm.
it can rear its head again for our older adults and cause a viral pneumonia, and kind of that same kind of like severe respiratory illness that we've been dealing
Right.
with, um, and become more aware of since COVID. And then the last one was the
Mhm.
pneumococcal pneumonia, which has its own vaccine. And so, it's confusing and there's becoming more and more vaccines to get. We used to only just have to think of that flu vaccine. Everyone
Right.
gets a flu vaccine, but now we have a whole variety of different options. And we really want our older nursing home residents to have access to all of them. So the recommendations for flu and COVID vaccines, there's the new formulation, the new version for this season, is for everyone 6 months of age and older to get the vaccine this year.
Mhm.
And then RSV, you need one lifetime vaccine if you're 60 and older and living in a nursing home.
Okay.
Um, and then for the pneumonia vaccine, um, that one has a little bit more complexity to it, but everyone that's 65 years and older will get at least one vaccine. Some younger people will need the vaccine earlier. You might need another dose later on. So that's one that's good to consult with your doctor to see which one is the right for you. But really, our older adults need the protection from these vaccines because they prevent severe illness. And yeah, that's why we're so excited about promoting them and spreading the word about these vaccines.
And so, do you have any thoughts on what facilities should be doing or what residents and families should be doing to make sure they get vaccinated? I talked to a group of residents a few months ago who talked about not being offered the vaccines last year and then not yet being offered them this year. I actually spoke to the same group of residents yesterday, and almost everyone had been offered, had at least been asked if they wanted to sign up for the vaccine. Some had actually already been vaccinated for the flu, COVID, and I think pneumonia, they mentioned. But we had one resident who said there's been nothing from his facility. And so, what questions should people be asking, and what would best practices be in terms of facilities making sure that people get vaccinated? Because I know there was a really robust program during the pandemic, but now that's sort of fallen by the wayside, and it seems almost more incumbent on residents themselves to make sure they're vaccinated.
Yeah, I'm glad to hear that some of the residents that you talked to who had trouble last season are having an
Yeah,
easier time or getting some access this season. And I think that is the key thing is they need to be, I mean, putting that pressure on or asking about the vaccine, displaying that
yeah,
interest in vaccination. Because one of the amazing parts of the early vaccine rollout for COVID was that, the government was providing the vaccine. It was not expensive for the facility. They didn't have to bill insurance, and all of public health was so focused on getting the vaccines
right.
into facilities. Pharmacists were being called in, and all these different people were taking part in the initial vaccine, those first doses of vaccine. Now the vaccines are being delivered via normal mechanisms, so you have to bill insurance for them. It's been confusing for many facilities on how to bill for the vaccines, how to give out the vaccines. And then if there's not that much interest in the vaccine, there's not always very much motivation to ever overcome any challenges with any new system. And so
Right.
I think really generating that demand for the vaccine is so important because it can help the facility motivate them to like overcome some of those challenges that they can have with getting the vaccines. And I think some things that have been shown to work really well to increase access to vaccines are, having a vaccine champion. So having someone kind of like monitoring how things are going, generating that interest and enthusiasm for the vaccine, making sure leadership of the facility is interested in the vaccine. And also, there's still resources that can help. So if a facility is having a particular amount of trouble getting the vaccine, there's the CMS Quinn QIOs can
Hmm.
provide assistance, and also the local public health department can help the facility connect with a pharmacy, for example, that could deliver on-site vaccines or find some solutions to the problems that they're having getting access. And I wanted to
Yeah.
also mention that both the skilled side, the short-term rehab folks and the long-term folks would benefit from vaccination because our residents are in those communal settings, and so there's a higher risk of, spreading the infection, so they need that protection.
Yeah, I really appreciate you adding that and saying that because, I was going to actually comment on your enthusiasm in talking about vaccines and how valuable I think that is because I do think there's a level of vaccine fatigue in the general community, where people say, okay, well, I've gotten 3 or 4 or 5 COVID shots. Why do I need another one? Or, I get sick when I get the flu shot, so I'm not going to get that. And I think for a while at the start of the pandemic, there was a lot of enthusiasm. I mean, I remember people lining up. I live in DC, and at least here, it was impossible to find the COVID vaccines in the beginning. And now, I mean, that's really shifted. And so I think really emphasizing that, frankly, from my perspective, everyone should be getting vaccinated as much as they can. But certainly for this population, we're talking about people who are really vulnerable. So I really appreciate that, you know, reminder and how excited you sound about vaccines because we should all sound that excited about vaccines, particularly when we're talking about this population who, can very easily end up hospitalized if they get some of these things and don't have that level of protection. So, yeah,
Yeah.
I'm
I mean,
yeah,
I think when we started the COVID vaccination, I think there was this hope like this is going to be, we'll be vaccinated this time and we'll be good to go for a while. It was so
right.
effective and such celebration.
It was
I think
disappointing when it didn't work that way. Like, that's
Well,
true.
yeah, but we've learned so much since then. And also,
Yeah.
we're monitoring so closely the virus, and we're seeing how the virus, just like flu, the
Hmm.
COVID vaccine also changes, the COVID bug, SARS-CoV-2, it changes with time. And also our immune system kind of can forget the lessons that we learned from the vaccine last time or the last infection that
Right.
we had. And so that's why we're getting these we're reminding our immune system with our new vaccine, and also we're getting new protection from the more recent circulating variants. So that's why we keep having to get vaccinated again.
Yeah. No, and yeah, and it's true. And I mean, I know again in the general population, I live near a CVS, you get a $5 coupon every time you get vaccinated. So there are
Hmm.
incentives out there. And so I do want to just, as we're talking about this and as we're mentioning this vulnerable population, we're also going to talk, moving forward in this conversation about all the people who are now entering facilities to visit, to see their loved ones. And so it isn't just this very vulnerable population that should get vaccinated. I mean, this is really important for everyone who's interacting with people who live in long-term care settings. So,
Hmm.
I mean, everyone should run out and get vaccinated if they can.
Couldn't
But
agree
but
more.
yeah, so it feels like though, as we're talking about this, that we are sort of in this like transition phase as we try as a country to leave the pandemic behind us. But again, within nursing homes, whether we're talking about COVID or we're talking about pneumonia or we're talking about norovirus, we're dealing with a very vulnerable population. And so I did want to talk a little bit more generally about infection prevention, not just for COVID, but for any viruses that might be spreading in facilities. And sort of what that looks like in this post-COVID world. What recommendations, what best practices there are in terms of infection prevention. One thing we've heard a lot about is that hand sanitizer containers are often empty when people go to use them when they walk into a facility. I
Mm.
talked to a resident yesterday who said that her facility was putting, different gowns they wanted because of illnesses, people to kind of gown up when they entered rooms. And so they put gowns at the front of each room. No one has ever taken one of those gowns out when they've come into her room. So,
Mm.
I mean, in some cases, it's almost like the systems are there. But what should be happening? What should infection prevention look like right now?
Yeah. Well, it makes me sad to hear those stories about I mean, not stories, those truths that are
Right.
out
No, no.
there about empty hand sanitizer, or, not using the personal protective equipment like the gowns when it's necessary. So, like, for this part, I like to take one step back and think about, like, why do we have these infection prevention interventions in general? And, for respiratory viruses is one specific group. And, there's a bunch of respiratory viruses out there, and we don't have vaccines for everyone. Your COVID test might be negative when you have a cold, but, you still have a cold. That's
Right.
still a germ that can be spread. And so that's why, especially in the nursing home setting where, people who are very vulnerable or living close together, there's, people going from room to room, staff are going from room to room, residents might be socializing with each other. A virus could spread very quickly. And how do they spread? Well, they spread via those droplets in the air when people are coughing or
Hmm.
sneezing. And those droplets can also land on surfaces or on your hands when you're covering your mouth or something like that. And then that can get, then when a resident or a staff touches a contaminated surface and then touches their mouth or their eyes or their nose, then they could get infected that way as well. So really what we're trying to do is prevent those steps from happening, that connection
Hmm.
between the virus and our bodies. And so, the hand sanitizer is key, because washing your hands, you never know, even if you're just popping into a room and you might not plan to touch anything in there or plan to do anything. You could just be like, oh, they need their coffee cup refilled, or they need, a little medication container. It's easy to just forget those processes. And so that's why we need hand sanitizer everywhere, easily accessible, so that hand cleaning is just second nature. And then I
Hmm.
think, when I think about, like, we're kind of breaking up what we want infection prevention to look like for respiratory viruses into like three kind of categories. One
Okay.
is how to prepare for the respiratory virus season. So we know that this is a time when in the community viruses are circulating. We don't have vaccines for all of them. So in addition to get vaccinating, we need to prepare by making sure we have masks available for visitors who are coming into
Right.
the facility. Those N95 masks need to be available for when we have a patient with COVID and our healthcare providers need to go in and see those patients and care for them. We need appropriate personal protective equipment, so we need those gowns accessible.
Mm-hmm.
Um, we need that hand sanitizer. And then we need to remind our staff, residents, and visitors what measures they need to take. They need to feel comfortable putting on that mask and understanding why we're doing it in this setting when maybe they don't need it at the grocery store, for example. But why do we want a
Right.
mask in this situation? And then I think one other way to prepare is making sure that the facility has leave policies in place that could allow a healthcare worker to
Right.
stay home when they're sick, and that visitors can stay home when they're sick, but maybe still have contact with their resident family member. So, is there like a video visit option, just so that the consequences of staying home when you're sick are not so harsh that we're choosing to spread an infection potentially rather than like staying home and protecting our residents. So after
Right.
you prepare, then the facility needs to respond when someone's sick. So even mild symptoms, a mild symptom illness for me could be mild, but for someone else it could be severe. I don't know if anyone's had that situation where
Mm-hmm.
they're feeling okay, just a sniffly nose, but then their spouse is like in urgent care with a severe sore throat or something like that, or their grandma gets hospitalized with the same
Right.
infection. Like we can't tell. We know there's higher risk groups. We don't know when that severe infection is going to come in. And so that's
Right.
why, even with mild disease, we need to test residents for the illness. We need to give them treatment if it's indicated for COVID or influenza. And we need our staff in facilities to wear the personal protective equipment and take the precautions when someone's ill.
Yeah, I mean, I think that's really important. And, I was going to sort of ask what recommendations you had for family members and for visitors because, not to go back to the whole idea of fatigue, but I do think that, after having to mask up and after having to do virtual visits, a lot of people just kind of want to re-enter those facilities. My daughter actually had a class trip. She's 12. Her seventh grade class went to a nursing home a few weeks ago. I made her wear a mask. I was just like, you're not going into a nursing home. Who knows what you have or what might be in that nursing home. There's one other girl in her class who also masked for the nursing home. They went on a Friday. On Monday, her teacher and classmates were out with COVID. And so the question is, did they take COVID into the facility or did they bring it out of the facility? Was anyone not feeling well before they entered? And did they just kind of not recognize that is okay, we're going into a more high stakes situation here. But I think you're right. And I think there's been a lot of, okay, I don't have any masks left, or I don't want a mask anymore, or I don't want to reschedule my visit. But it is really important, especially entering the season where, like you said, there's so many different things going around. You might not take COVID into a facility, but you might take the flu in, and that can be just as dangerous to people.
Mhm.
And so making sure that as visitors, we are not exacerbating the situation when we enter, even if the staff are taking all the measures they need to and the residents are taking all the measures they need to, we don't want to be the ones who then go in and create a problem within that facility. So I think that's really important.
Completely agree. Yeah.
And so that kind of takes me into my next question, which, does kind of go back to COVID a bit, but just in terms of how the general population is behaving and sort of what things look like in nursing homes. What are the COVID guidelines that are left in nursing homes right now? We've heard of a lot of inconsistencies in terms of how COVID has been treated by different nursing homes in different states, sometimes within the same state. And certainly the situation for how COVID is treated in a nursing home is, for understandable reasons, different than how COVID is treated in the general community today. But what guidelines are there still kind of out there that people are following or are required to follow in nursing homes?
Yeah, great question. Um, So, see, we do still have some COVID specific guidelines, and really for nursing homes, the CDC considers nursing homes a healthcare like setting,
Mhm.
because people are so close, they're living together. Large groups of people are living in the same environment. They're getting care from healthcare providers,
Mhm.
and they're, older and at high risk for contagious infectious diseases like respiratory viruses. And so, even before the pandemic, for influenza, for example, or the flu, for RSV, which was present before the pandemic,
Mhm.
for many different types of infections, CDC provides specific guidance, for example, how long a resident needs to be isolated or needs to have, precautions. Um, when they have the infection, what kind of personal protective equipment should be worn for the individual, how long maybe a healthcare worker might need to stay out of work or take extra
Right.
precautions. We've had those specific guidance for the bug, for many different bugs before the COVID-19 pandemic. So it's not unusual for us to have specific recommendations for a specific bug. And so we still have those same specific recommendations for COVID, for in terms of, what personal protective equipment are needed, when to do testing, for example, different strategies to prevent spread within the facility. And then we also have the guidelines or guidance in terms of like how long a healthcare provider should stay out of work if they're not feeling, if they are diagnosed with COVID-19. And those are specific currently for COVID-19. And I will mention, though, you bring up a good point. Things are changing all the time. And one of the challenges we
Mhm.
had in the pandemic was communicating all of those changes that are happening.
Right.
Why is it 5 days now and 10 days the next day? What happened
Mhm.
there? And so, just like you were mentioning for COVID, we have regular reviews of the data that come in, and there's actually an external kind of group of experts that help CDC develop the guidelines on, how to handle COVID in healthcare facilities. So they're currently working on, looking at the data, and we'll continue to review that data and provide updates. So, this time next year, we may have a slightly different recommendations for COVID-19 compared to last year. But it's all just based on what data are available, as we learn more and as the virus evolves.
Right. So what can you share what some of the guidelines or guidance is right now for residents or healthcare workers within nursing homes? What currently the CDC is sort of saying?
Yes. So, I think one of the first steps that our guidance recommends is
Mhm.
that we need to identify when a resident has COVID-19 or if they have
Right.
another type of respiratory illness. And in any case, anytime a resident has symptoms, there needs to be precautions in place so that they can be safe themselves and also limit the spread to other healthcare workers or other residents or their family members that are visiting. So the first step is recognizing those symptoms, providing appropriate personal protective equipment. So basically, if someone develops symptoms, our guidelines recommend that they, you know, if possible, have their own room.
Mhm.
Wear a mask if they try to stay in their room as much as possible. Wear a mask if they need to go out of their room. The healthcare provider should wear personal protective equipment for COVID because that's the most comprehensive, that's the most protection. And then if their test for COVID is negative, they can kind of reduce that amount of personal protective equipment. If they're positive, though, they'll need to continue wearing the personal protective equipment. And then based on CDC offers like a couple different scenarios for based on how severe the disease is for COVID.
Mhm.
Um, for example, how immunocompromised the patient is, what kind of follow-up testing is available. We have a kind of a variety of different recommendations for how long those precautions need to be in place once the resident is diagnosed with COVID-19. And then it also has recommendations. We also have recommendations, for example, for testing contacts and monitoring closely contacts of that
Yeah.
resident to make sure, or the staff member, to make sure that, any infections are caught early and they can benefit from some of the protections. And also, we want to make sure that our residents have access to treatment. So for COVID-19, one of the benefits of testing early is to make sure that they can get access to treatment for flu or COVID. We have great treatments that prevent hospitalization and death. So, there's benefits in terms of limiting transmission by, identifying the resident early, testing and providing personal protective equipment, but also for the resident in terms of getting treatment is really important.
Yeah, so I mean, a part of why I'm asking, and that makes a lot of sense. I'm glad you brought up testing because I actually talked to several residents yesterday who were saying it really seems to vary when someone gets sick in their facility. Who gets tested? Is it the people on that person's floor? Sometimes it's just the people who sort of live on the same floor as that resident who maybe contracts COVID will all take a COVID test. In other facilities, people are saying it's people who are displaying symptoms, but if you're asymptomatic, they're not going to test you for COVID, even if you do live next door to that resident. So there just seems to be a lot of differences. And then in terms of the quarantine time period, we've actually heard from several residents and family members that they're still quarantining for a full 10 days. Some people said 7 to 10 days, and then they test again, and then they can kind of rejoin the rest of the community. But in other places, it's 5 days. And so I guess my question is, from like the CDC's perspective, is this really something that is being left up to states and facilities at this point? Or is that like just different interpretations of the current guidance that you have? Like how, like just kind of speak to the discrepancies, I guess, a little bit in how that's happening. And I would assume with the testing, it might actually be availability of tests, which is sort of a whole nother potential issue. But
Yeah. Yeah, there's a lot to unpack there. So one
yeah.
thing on the terms of the testing that I just wanted to promote since I
Hmm.
have an opportunity is that I think it was not very well publicized or very well known, but actually free tests, antigen tests for COVID-19 are still available from the federal government through HHS
Yeah.
ASPR. So facilities can actually sign up to get weekly shipments of tests for free. And
Oh,
so I
that's
think that's
great.
really helpful because I think it may be tricky sometimes, like when you're doing the in contact investigation and who to
Hmm.
test in terms of getting those tests paid for. You need to test healthcare workers, you may need to test other residents, it gets tricky. And so, having that source of tests, I think, can really help make it easier. And I think that you bring
Yeah.
up a good point. It's that, CDC, we're kind of making these, like, we're kind of interpreting the science and providing kind of several options in terms of how to, um, use the transmission-based precautions, or, how long the resident needs to have personal protective equipment used by healthcare members staying in their room and things like that. And there's just so many different scenarios. I wish it was
Right.
simpler, but it's different scenarios based, like I mentioned, on their immunocompromised status, how bad the infection was to begin with, etc. And so that can definitely cause different variability. And ultimately, we provide guidance, but the states, the local
Right.
public health, and the facilities themselves are the ones that are applying those guidances. And so there can be variability in that way. And, like, for example, testing the contacts, we say you should just investigate who's been in contact and test those people, but we don't say, like, use the whole floor, or
Right.
that's really up to the people on the ground to decide what's indicated. Um so yeah, that's one of the intricacies. You don't want to provide too much information because then people struggle to, like, apply it to their personal situation. But you need to provide enough to ensure safety.
Right. And as you're talking about free tests being available to nursing homes, I also want to emphasize that the government is currently also providing free tests to individuals in the community, anyone who wants one. I know they've done this several times over the past few years, but you can apply if you're listening for 4 more COVID tests per family or per household right now on the government's website. And as we talk about, again, testing people who are close to people within a nursing home, I do want to just emphasize again, if you're feeling sick, and you're thinking about going to visit a nursing home, it is really important to take a test and make sure that you're okay, and also to wear a mask when you enter that facility. Because, like again, I just mentioned there are residents who are currently being quarantined for long time periods when they get COVID. That isn't happening to the general population. If someone, outside of a facility gets COVID, what is the current recommendation, like to take precautions for 5 days, or you don't end up quarantined in your bedroom for that time period, but somebody inside that nursing home might. And it often isn't resident, as actually several residents said to me yesterday, what frustrates them is the spread in nursing homes, in their opinion, isn't resident to resident to resident. It's other people coming into the facilities. It could be staff members going from room to room. It could be community groups that enter, and things like that. So again, it's just as we talk about entering and visiting relatives and loved ones during this holiday season and just generally during respiratory season, it is really important for the general population to be taking these precautions. But
Yeah, absolutely. And also it's great to mention that just because your COVID test is negative if you're having respiratory symptoms, it's
mhm.
still very advisable to stay home. If
Yeah,
or if you're not able to stay home, then please wear a mask because we have a limited ability to monitor other respiratory viruses, but in some settings, CDC has seen that, our residents are being hospitalized for other respiratory viruses other than COVID and flu, the ones we have more easy testing access for. These other viruses still cause hospitalizations and significant illness. So it's just good to think about that aspect.
yeah. I mean, I think that's a good point. And I think when we think about the flu, I know when COVID first sort of hit, that was the comparison we were making. Oh, well, the flu hurts this many people or hospitalizes this many people, but COVID is this much worse. The flu is still hospitalizing all of those people, and
Yeah.
so it's really important to really stay cognizant of that. Um,
hmm
so to kind of switch gears again, are there any positives you have seen come out of the pandemic? What do you think in terms of infection prevention and some of the things we've talked about? We might actually be doing well right now, if anything. But sort of what have we learned and sort of gotten from this experience that has improved?
I know sometimes it's hard to think of the positives when it comes to COVID, but I think, well, first of all, the vaccine to me is like an incredible positive.
Yeah.
And in addition, just the COVID vaccine, the incredible rollout of the vaccine where all of the nursing home residents were vaccinated in such a short period of time. We saw how these nursing homes, these facilities were willing to go to, they had to be creative. There weren't a lot of resources, but they got their residents vaccinated. And I think, that momentum is so important. And,
To keep, yeah.
and along with that, the vaccination, there was so much more education and uptake of infection prevention. Like, yes, we need to keep the hand sanitizers refilled, but at least those cartridges are up on the walls now at a much, a
Hmm.
larger frequency than they were before the pandemic. And so I think, those are really really important positives, and this is also like a really delicate time where we need to keep those positives there, because even though the rest of the world is opened up, we can go to the grocery store and everything's there, and we can visit our families and we can go on vacations. It's really important to remind ourselves that these infections are still circulating. Like you mentioned, the vulnerable residents are still there. They can still get hospitalized even though it's not quite as severe as it was when things first came out for COVID. um, and we know how to prevent them now. Like we're aware of it.
Right.
We just got to keep that information up, that strength that was built there.
I think that's a really good point, and it sort of flips the way I have thought about this a lot. But I did say at the very beginning, we've all had a crash course
Yeah.
in infection prevention and all of this, and I do think there is a lot of fatigue in the world. But at the same time, this is all information we still possess. We all lived through this time period, and to a point you made earlier, many of these things that we implemented in COVID were already things that we would do in nursing homes, for instance, like when the flu happened or other things happened. And so, maybe people weren't as aware of that, but now we sort of have the tools and we know how we can behave and what we should be doing. And it really is a question of sort of harnessing that. What, to sort of flip the question, what things do you think could still be implemented in terms of better infection prevention? One question I have is about air quality. This is something that I think came up a bit during the pandemic. Better air filtration. I know like some schools have changed air filtration and things like that. We actually go to a restaurant here in DC that on their website talks about how they upgraded um, the air quality in their restaurant. And so it's a safer restaurant to eat inside of during outbreaks and things like that.
Interesting.
But yeah, I know I kind of love it. And so I take my kids there a lot because I'm like, look, they have all this information about their air quality on their website. But in a restaurant, that's one thing, but in nursing homes, that seems like something that could be really important. Is there any effort or any thoughts towards that? And then, just earlier, as we were talking about vaccines, just, bringing back that easier access for vulnerable populations, how can we sort of get to a place where some of these things that feel a little bit aspirational can happen?
Yeah, I completely agree that there's still work to be done. And one thing that came out of the pandemic, I think, is that, on the vaccine topic, I'll start with vaccines and then
Hmm.
shift over to infection prevention, especially the ventilation aspect. In the past, pre-pandemic, we weren't really thinking about the vaccines for adults. Like we weren't,
Right.
that wasn't our big focus. We were really focused on children. And I think now we've realized how important vaccination is for adults. There'll be more it's a big market. There'll be more vaccines for adults that, come down the pipeline, that, we need to have pathways in place that make it easy for people to get vaccines, and also that people feel comfortable and safe getting vaccines. They're not, we don't want,
Yeah.
we want to be able to communicate the benefits: reduced hospitalization, reduced severe disease, you know, um, and kind of be able to share the safety of the vaccines as well, and all the procedures that are in place for that safety. And then when someone wants a vaccine, we need ways for them to get it. I think one of the big challenges right now, for example, is some staff in nursing homes don't have insurance, for example. So where can they
Right.
get their vaccines now that COVID vaccines are no longer free and all of our vaccines are just getting more and more expensive? Because new technologies have been introduced, and now
Right.
vaccines a flu vaccine used to be $20. Now maybe it's $100 in some cases. And so I think we still need to work towards that universal access to vaccines, and that high uptake of vaccines.
Yeah, I think
And
that's
so
really important. And and I do want to go back to the other aspects of that question that I asked, but another question I was going to ask is just sort of like what goals we have in terms of public education moving forward. And as you're talking about vaccines, I feel like you're right. Like that is a huge one in terms of making people understand that vaccines are safe, making them understand why they're so important. But to your point, yeah, I mean, it's a lot to ask somebody who doesn't have insurance to go out and get vaccinated.
yeah.
And that it shouldn't be that way. So yeah.
Yeah, and I think, for nursing home residents, I think the vast majority would have insurance, or they would be private
Right.
pay, and maybe the
Hmm.
insurance issue would not be as much. But for our staff, for like staff in all kinds of
Hmm.
settings, and like our
Yeah.
essential workers and all kinds of things, that vaccine access is so important. And there is work towards a legislative solution, which would be more of the vaccines for adults program, similar to a
Hmm.
vaccines for children, but that hasn't been, budgeted for yet. So we're really, trying to raise awareness about the issue so that it becomes like something that folks are thinking about. Yeah, that importance of vaccines throughout the lifespan. So yeah, it's such a chief concern. And I think going over to the infection prevention, I think the ventilation is a really interesting topic. It's been an area that we haven't emphasized as much in our guidance in terms of prioritization.
Mm.
And I think it also is really expensive because,
Right.
many nursing homes and other even, acute care hospital type facilities, they're kind of older, maybe,
Right.
it takes a lot of money to um, make drastic changes into ventilation system. But I think there are some easy things that we're trying to promote. So part of that preparedness for the respiratory virus season is making sure that the vents are not blocked for air uptake
Right.
and
No,
circulation.
absolutely.
Kind of understanding having the facility managers kind of see what optimization they can do. How close can they get to those 5 air changes per hour, with their system? And then, how would if a resident like adjusted the thermostats in their room, how would that impact airflow? Do there need to be kind of precautions about changing air filtration? So there's definitely things that can be done now, like without major investments, that can help maintain ventilation. So we're really trying to like keep one move that we're making. Instead of like thinking, okay, for COVID you need to do this, for flu you need to do this, for RSV you need to
Right.
do this, we're trying to say like, all respiratory viruses will benefit from these infection prevention
Right.
measures. Wear a mask, you know um use personal protective equipment and follow the guidelines for not isolation, but precautions while you're caring for a resident. Stay home when you're sick. These things will all respiratory viruses can benefit from these interventions.
Well, yeah, and you mentioned the staying home when you're sick, and I know we've talked about that quite a bit from a visitor perspective, but you had mentioned earlier in this podcast, having sick time for workers who live in nursing
Yeah.
homes. I mean, this is, we hear about this, right, in every setting, when you don't have sick days to take off, people in restaurants or in food service industries are going to work sick and spreading different types of viruses and bacteria because they're not at home, where they should be. And so that's another really good point, as we talk about making sure that nursing home workers have access to vaccines. It's also making sure they have access to sick days so that they don't feel compelled to come to work even when they're not feeling well. So that was a really good point you made earlier that I thought kind of circled around, and so I wanted to come back to it here. Is there anything else that you wanted to add or share with everyone, before we close
Ah,
out?
you know what? I think maybe one last thing that I wanted to leave with was just, I think the pandemic helped us show how important it is for nursing homes and other long-term care facilities to have a seat at the table in public health.
Yeah.
Their needs really matter. The residents' needs are very unique. They're so vulnerable, but they also have their own like logistical challenges and special needs. And so I think, when public health is are preparing their responses and different logistic aspects or thinking about allocation of resources, like we really need to work to have nursing homes at the table or included in these public health discussions at the local level. And I think that's something that's going to be require advocacy at that local level, both from public
Yeah.
health and also from the facilities and residents themselves. But they deserve to be there, and they make important contributions. So there are twice as many, at least, nursing homes alone, not even including assisted living, compared to acute care hospitals. We'd never think of leaving the acute care hospital out of the equation. We need to keep our nursing homes in the equation too for public health.
Well, I think we really appreciate that perspective at Consumer Voice, and I think it's really accurate. The other thing I just want to add, is as we talk about residents and their own advocacy, that as we've talked about a lot of these different infection prevention methods and things throughout this conversation, I want to emphasize again that for a resident living in a nursing home, that is their home. That is their safe place. That is where they live. And, if you are a resident who's listening right now and you have people who you think seem symptomatic or who you want to wear a mask before they come into your room, you can ask for that. You have the right to keep yourself safe and make requirements of people who are coming into your room. And so, as we talk about all of these things, I don't want to leave the impression that not only are nursing home residents vulnerable, but they're also powerless. They have a lot of power. And like you said, I love talking about this from the perspective of making sure they're included in these conversations, but also just, when they're at home, when they're in their own nursing home, they have the right to keep themselves safe as well and can advocate for themselves. So
I
thank you so
love
much for joining
that.
us. Yeah.
Thank you. It's been a real pleasure.
Yeah, this was really great. Thanks so much. So I just want to thank Erika again and introduce my colleague, Lori Walsh, who spent over 20 years as an ombudsman. We just wanted to add in her perspective about some of the things that Erika and I just talked about. And to start with, the last point Erika made, which I think was so important about ensuring that nursing home residents have a voice at the table as we talk about these issues. Lori, I really want to get your input on that. But I also want to hear what takeaways you have as a former ombudsman after that conversation, and what else you think residents and families should be made aware of.
Sure. Thank you so much, Jocelyn. Yeah, I was thinking a lot about, the rights that nursing home residents have while listening to that podcast. And it's really important for folks that live in nursing homes to remember that they have a right to be informed about policies that are happening within their facility. And even though we all might have COVID fatigue, that doesn't mean that the facility can be lax about what kind of policies they have. So in order for residents to be making informed decisions about being vaccinated, about having visitors, they also need to see what the facility is doing, to make sure that they have proper supplies, and also what they're doing to make sure that they have access to the vaccinations, and what their policies are regarding visitation. Because, as we all know, nursing home residents have a right to receive visitors of their choice at any time. And once the public health emergency ended last year, everybody needed to go back to remembering that federal law provides nursing home residents with the right to be making decisions, informed decisions about who visits them.
And yeah, I think that's really important. And I do think it's important that we make sure that residents have all the information that they need. The other thing I know we talking about is choice. So can you talk a little bit about the choices that residents have regarding all of this?
Sure. So it's easy for people that live in nursing homes to forget that they still have the right to make decisions that work for them. And they may
Right.
not be in alignment with what the nursing home thinks it should be. One of the things that's really difficult for anybody who is an advocate, right, for nursing home folks is the balance between safety and providing good medical care versus a person's right to make decisions that work for them. So I bring that up because while the first part of this podcast talked a lot about making sure that people are vaccinated and allowing access to that, it's also important to remember that nursing home residents have a right to not get a vaccine. Now, what that also means, and this goes back to the idea about being informed, is that when they're making decisions like that, they do need to be informed about consequences. And also, it may limit other things if they're not vaccinated. But the bottom line is that for as long as you are not adjudicated as being incapacitated, you have a right to be making decisions on your own behalf, and it may not follow what is considered to be the norm, or what like the mainstream considers is the way it should go, and that includes choosing not to be vaccinated.
I think that's a really good point. And I also want to point out, I know we just talked about this recently, but that also pertains to the family's wishes. The resident has the right to make that decision. And that means they have the right to get vaccinated, even if their family members are against vaccines. It means they have the right to not get vaccinated, even if their family members want them to get vaccinated. These rights still lie with the resident. So I think that's a really important point, and I don't think we really, emphasized that enough earlier. And then, the last thing I really wanted us to talk about was what Erika said at the end, which I think was so important, just in terms of residents having a voice at the table, and what that looks like.
Sure. So I think that, part of the role of the ombudsman is to empower people that live in nursing homes to feel comfortable speaking up, right? And, part of that also means, speaking up when people come into your room. So, and I know that this is something I just want to make sure everybody understands, is that the room that they're residing in is their own room, and they get to decide, you know, when they have visitors, if that visitor is going to be masked or not, if they want them to stay 6 feet away. That all speaks to feeling comfortable speaking up about your own interests and needs, right? If you are feeling like you are not able to speak up, you don't feel empowered to speak up on your own behalf, there are other avenues, and that includes the local long-term care ombudsman. So in every nursing home, there are posters that give information about their local long-term care ombudsman. The phone number should be prominently displayed. The Consumer Voice website has a wonderful locator so that people can access the local ombudsman. The ombudsman is an advocate for the person that resides in the long-term care facility and will speak on their behalf with regarding whatever the complaint is, and it includes all complaints. But then there are also other interesting, aspects to, speaking up. And that includes things like at the Consumer Voice, we have a Consumer Advisory Council, which, is made up of a number of, right now, mostly nursing home residents, right?
Mostly,
Okay.
yeah.
And, around the country, who generally are in advocacy roles. Resident council presidents are very active in their facility, and they are really working on making sure that the policy within the nursing home is good for nursing home residents. But one of the things that they do at the Consumer Advisory Council is help us to be informed about what's happening on the ground, so that when we are conducting policy work, we are making sure that we are truly the consumer's voice for issues. So, as hard as it is, just to bring it back to, this larger issue, sometimes it's really hard to speak up about what you want in a nursing home. And that, even though people have very strong feelings about being vaccinated and having visitation and being isolated or not being isolated, we are at a transitional period where we all get to make decisions that work for us. And, certainly when folks are living in congregate settings, it's important to be thinking about the wider population, right? And knowing that there are going to be some consequences to the decisions that they make. But just because you're labeled a nursing home resident doesn't mean that you do not get to have a say. So there are, mechanisms in place to help you if you're not feeling comfortable doing that on your own.
Yeah, I think that's really important, and as you were talking, I was thinking about some of the things that we talked about earlier in the podcast with Erika, um, which are also all things that nursing home residents or their families should feel comfortable advocating for. You use the term, nursing home residents should feel comfortable asking for what they want, which I think is so important to frame it that way, because you deserve what you want when you're at home. But it's also what's required. And, it's important for residents to understand that if their nursing homes aren't providing some of the things that their state law requires or that the CDC requires, that they can ask for that. And if they are not making headway, or as you pointed out, if they are uncomfortable asking for it on their own, they can look at their resident council, or they can reach out to their local ombudsman office and try to make change that way. And then just to reiterate what you just said, in terms of having a voice at the table, it is important. And I do think that our Consumer Advisory Council, and if you're a resident out there listening, or a family member who knows of somebody living in a nursing home or assisted living who would be interested in joining our Consumer Advisory Council, we do provide opportunities to talk with people in the government, to talk to policymakers, and try to have an impact on that level. So definitely feel free to reach out to us and email us and get involved. So thank you so much, Lori, for coming in at the end and adding so many important points.
Thank you very much. I really appreciate it.
Yeah, thanks a lot.
Thanks for joining us on Pursuing Quality Long-Term Care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Make sure to visit our website, theconsumervoice.org/pursuingquality, where you can subscribe to the podcast, follow us on Facebook and Twitter, and find more information and resources. If you enjoy the podcast, please rate, review, and subscribe. Thank you for listening, and we'll see you next episode.